Here we will discuss about the production of breast milk, which is also called lactogenesis. So we have introduction, then we'll go to the anatomy of breast, then the physiology of lactation, how the hormones are produced, and what is the time interval, and how it affects the breast milk production, and then finally to the production of breast milk, which is called lactogenesis. The best milk for a newborn baby is unquestionably the breast milk, and all babies must be exclusively breastfed till the age of 6 months of age. All newborns without any complication should be kept in skin-to-skin contact with their mother during the first hour after birth to promote breastfeeding and to prevent hypothermia. Complementary food should be started only after completion of 6 months of age. Coming to the anatomy of breast. Now the milk is produced in milk secreting glands, and the milk secreting glands can be seen with a lining of milk secreting cells, and these milk secreting cells produces milk in response to a hormone called prolactin, which makes them secrete milk. And the glands are surrounded by muscle cells, smooth muscle cells. And these smooth muscles contract in response to a hormone called oxytocin, which makes the milk to eject outwards towards the areola and the nipple. Inside the areola, you have the lactiferous sinus, which is full of milk. And finally, the milk comes out of the areola and into the nipple. The areola is the brown area around the nipple, and it contains glands called Montgomery gland. So the milk secreting glands have units called alveoli, and then there is supporting tissue made up of fat and connective tissue. So basically the milk gets collected in the lactiferous sinus. Again, same anatomy is explained here also. There is the alveoli, which is the units of glands, milk producing glands, which drain in the milk into the lactiferous ducts and sinuses. And the glands are supported by suspensory ligament and fat. Finally, the milk comes at the areola nipple area. The milk flows from the glands, the alveoli, into the lactiferous sinus and into the nipple through the lactiferous ducts. Now, some of the babies may not attach well or latch well while sucking. They may just suck at the nipple instead of sucking the entire areola nipple area. And it's common the first few days of a life for a baby to have trouble latching on or maintaining sucking at the breast. If the baby sucks only at the nipple, then there is a problem. The lactiferous sinus, which are below the areola, are not emptied, leading to poor secretion of milk. And there will be injury to the nipple. It may bleed, and baby may have less milk. There may be low blood sugar. Baby may lose weight, may not have enough urine output, and baby may be fussy and crying throughout. So it's better to have a good latch, and good attachment is the key to successful breastfeeding. Now, the hormonal influences. The estrogen stimulates the ductile system to grow. The progesterone, which is secreted from the placenta, increases the size of the alveoli and the lobes. And the prolactin, which is made from the pituitary of the mother, it helps in the, it stimulates the alveolar cell to secrete milk. The oxytocin, which is produced in the milk ejection, which is produced in the posterior pituitary area, it leads to contraction of the smooth muscles and ejection of milk into the alveoli, into the nipple. So the milk production is called lactogenesis, and lactogenesis is the process of developing the ability to secrete milk and involves the maturation of alveolar cell. It takes place in 2 stages, and stage 1 is the lactogenesis, where secretion is initiated, and stage 2 is and then stage 2 lactogenesis is there, where secretion is activated. Secretory activation happens. In stage 1 lactogenesis, the secretory initiation takes place, and it happens during the second half of pregnancy. The placenta supplies high levels of progesterone, which inhibits further differentiation of breast tissue. And in this stage, small amount of milk can be secreted by around 16 weeks of gestation. By late pregnancy, some women can express the first milk called colostrum. Stage 2 lactogenesis is secretory activation. It starts with copious milk production after delivery. With the removal of the placenta at delivery, there is a rapid drop in the progesterone hormone in the body of the mother, as well as there is a presence of elevated levels of prolactin, cortisol, and insulin, which stimulates this stage to develop. And usually at the second or third day after delivery, most women experience swelling of the breast along with copious milk production. And late onset of milk production and lower milk volume is usually seen in women who have retained placental fragment, because these retained placental fragment will continue to secrete progesterone. Therefore, it is important to remove any retained placental fragment from the uterus. And in women with diabetes and primiparous women, and also women who have delivered by C-section or stressful vaginal delivery, the onset of milk production may be delayed and the milk volume may be low. So this is the different stages of milk production. Stage 1 starts around 16 weeks, where the progesterone is increased. And stage 2 starts with the dropping of the progesterone after the placenta is removed, after delivery of the baby. And there is a rise in the prolactin. And stage 3 is at around 3 months, where the prolactin hormone drops. And however, the milk secretion continues because of the local hormone control in the breast tissue, which is called autocrine control. So there is a prolactin reflex that happens in the mother. And the reflex means it is an automatic system to cause the secretion of milk. And it is stimulated by the sucking of the baby, expression of milk using hand or pump, emptying the breast of all the milk, and night feeds. So feeding during the night is also important to increase the milk. At least the mother should feed at least 4 to 5 times during the night. And these stimuli will cause the anterior pituitary to produce prolactin hormone, and the prolactin hormone stimulates the secretory cells in the alveoli of the breast tissue to produce more milk. And this reflex is inhibited by incorrect position of holding the baby and any pain, including painful breast. Prelactal feeds like water, honey, or formula feeding also reduces this reflex and reduces the production of milk. Therefore, it is important to avoid as much as possible formula feed. As much as possible, do not give any other fluid other than mother's milk. Always avoid prelactal feeds. So the prolactin reflex sucking acts as the afferent stimuli, where the nerve ending in the nipple carry the impulse to the anterior pituitary, which in turn releases the prolactin. And the prolactin is then released in the bloodstream and induces the cells of the alveoli to produce milk and distance it. The more the baby sucks, the greater the milk production. So if the mother has twins, two babies, or triplets, three babies, or quadruplets, the more the babies suck, the more milk production happens. So sometimes even twins and triplets, mothers may have sufficient milk to feed the babies without even any formula feed because of this milk secretion reflex or prolactin reflex. So the more the baby sucks, greater the milk production. Then there is a second reflex called the oxytocin or the milk ejection reflex. This is also an automatic system where the stimulus is produced by, again, by thinking lovingly of the baby, the sound of the baby, the sight of the baby, and when the mother is relaxed, comfortable, and confident, and the baby is sucking, the stimulus goes towards the posterior pituitary where the oxytocin is produced, and the oxytocin enters the secretory, the alveoli, the smooth muscles surrounding the alveoli, making the smooth muscles or the myoepithelial cells to contract and eject the milk into the baby's mouth. This reflex is again hindered by unnecessary worry and overthinking and unnecessary stress and pain and unnecessary doubts. So it is very important to make the mother relaxed, comfortable, confident, pain-free. So the sucking by the baby is the most important stimulus for the production and secretion of milk in the mother. So the milk ejection reflex or the oxytocin reflex, the oxytocin is produced by the posterior pituitary gland in response to the stimulation to the nerve endings in the nipple by sucking as well as the thought, sight, and sound of the baby. The oxytocin is responsible for the contraction of the smooth muscle or the myoepithelial cell, and the milk is then emptied from the alveoli to the lactiferous duct and into the baby's mouth. The reflex is affected by mother's emotions. A relaxed, confident attitude helps enhances the milk ejection reflex. On the other hand, tension, stress, pain, doubt will hinder the milk flow. Factors decreasing milk production are pacifiers, bottles, then painful breast condition like sore or cracked nipple and congested breast or breast engorgement. Giving sugar, water, honey, prelactal feed to the baby can also hinder milk production. Lack of night feeding. Some mothers may think that they will give formula feed during night, and then that also can cause decrease in milk production. So never give formula feed during night. Instead, you have to sleep during daytime, switch off the lights and close your eyes and feed more during, switch off the lights and close your eyes during the daytime. Sleep with the baby and feed more, at least 4 to 5 times, more times during night to stimulate the milk production. And these are the advantages of breastfeeding. For the baby, it is a complete food, species specific, easily digested, well absorbed, protects against infection, promotes emotional bonding, and better brain growth. For the family and the society, it saves the money, promotes family planning, decreases need for hospitalization, contributes to child survival, reduces mortality. Benefit to the mother, very important, helps in the involution of uterus, delays next pregnancy, lowers the risk of breast and ovarian cancer, and decreases the mother's workload. Composition of breast milk. Initial milk is called colostrum, which happens in the initial 3 to 4 days after delivery. It is small in quantity and yellow and thick, contains more of immunoglobulins and proteins and minerals and vitamin A, D, vitamin E, vitamin K. Then comes the transitional milk, which is secreted from the 3 to 4 days to up to 2 weeks, which is rich in fat and sugar content. And then comes the mature milk, which is thinner, watery, and contains all the essential nutrients needed by the baby. The foremilk is the initial milk that is secreted in the start of the feed, and it is rich in water, protein, sugar, vitamin, minerals, and it satisfies the baby's thirst. Whereas the hind milk comes after 10 to 20 minutes of feeding. And it is richer in fat, it is creamy, it comes out late towards the end of the feed and provides more energy and gives a sense of satisfaction and satisfies the hunger. Therefore, it is important for emptying the full breast while feeding so that baby gets both foremilk, which is rich in water, and the hindmilk, which is rich in fat, and also help the mother to avoid problems of breast engorgement. Skipping or delaying feed can cause the breast to be engorged overly full, which in turn slows the flow of blood to the alveoli, that is the milk producing cells, and decreases milk production. Thank you for your patient hearing.